Sasa life ya ule mtoto hajavaccinatiwa, unapatanga immune yake iko chini sana, kwa hivyo hata outbreak kadogo kakitokezea, ako kwa hali ya hatari ya kukufa ule mtoto. Ndiposa tunawaelimisha waweze kukua na hizi vaccine zote.
More than 1.5 million children die every year from diseases that are preventable with vaccinations. Since 2000, Gavi, the Vaccine Alliance, has helped immunize over 760 million children, preventing more than 13 million deaths. In 2014, Global Citizen launched a petition calling on world leaders, particularly from Canada, to increase support for Gavi. The petition amassed over 26,000 signatures.
In 2014, I signed a petition to give millions of children access to life-saving vaccinations. I really admire Global Citizen's platform because it's cultivating a generation of change makers, and it utilizes social media and a lot of the way we communicate today.
In 2014, Canada announced a major commitment of $500 million Canadian dollars to Gavi.
The global reduction of child deaths that we have seen from nearly 12 million to 6.5 million between 1990 and 2012 is due in large part to the scale up of essential vaccines.
As the International Development Minister in 2014, Christian Paradis was instrumental in Canada's decision to invest in Gavi.
This was our government top priority when we would speak about mother and child newborn health. So of course, Gavi was a natural vehicle for that.
Canada's contribution put Gavi on the path to vaccinate 300 million children and save 5 to 6 million lives by 2020. But it was the work of Global Citizens that helped solidify the need to fund Gavi.
And governments have to listen because Global Citizen is a large organization gathering a whole bunch of people from everywhere, and it had a big impact in our decisions back in the days.
The funds from Canada, along with countries like the US, UK, and others, made it possible for Gavi to support on-the-ground programs to ensure children are vaccinated. One of those programs is CANCO in Kenya, which focuses on health advocacy and community health programs. CANCO recently hosted a program at an informal settlement in Nairobi. Over 2 days, community health volunteers went door to door, encouraging people to visit the health centers where workers were providing health education and administering vaccines.
I'm having my child vaccinated because giving a baby a vaccine, it's very important. I've seen kids that are not vaccinated. It's like the polio, they become paralyzed, they are not healthy. They are very difficult to take care of them.
Niko hivi juu mamangu alinipea chanjo na sasa ndio maana niko hivyo healthy.
The Canadian government has remained committed to global health. In June 2019, Canada announced a 10-year pledge to increase funding for women's and children's health.
I announced that Canada will increase our investment to $1.4 billion annually to support women and girls' health globally.
And Global Citizens can use their voice to help direct that funding to where it's needed most.
I would encourage people to each take action because with collective action, we will then see collective impact.
Let's ensure that Canadian leaders continue to fund vaccines for children through Gavi's next replenishment in 2020 and beyond. Go to globalcitizen.org and take action today.